Hello, Andrew Colsky here from StopMyOCD.com. Today we're going to talk about a really important topic: what helps with panic attacks. Panic attacks can be really scary and really frightening, and all we want to know how to do is make them stop. So let's go ahead and get started talking about that. Dealing with a panic attack can be challenging, but there's several strategies that can help you manage and cope with the intense feelings of fear and discomfort, and we're going to talk about several different steps that will do that. First and foremost, it's important that you recognize it as a panic attack. Knowing that you're experiencing a panic attack and that it's a temporary episode can be reassuring. Remind yourself that panic attacks, though very distressing, are not life-threatening. Now, I do have another video that compares panic attacks, heart attacks, and anxiety attacks, and I think you may want to take a look at that one so that you can understand the differences. But when you recognize you're having a panic attack, one of the things you can do is find a safe environment. You want to move to a quiet and safe space where you can sit or lie down comfortably, undisturbed. Remove yourself from the overwhelming or triggering situations, and that can help you focus on managing your panic attack. So basically, get away from the triggers, get away from all the things that might be distracting you. Next, when you're in a safe place, you can start by practicing deep breathing. Take slow, deep breaths to help calm your nervous system. This is something where you can breathe in through your nose for a count of 4. You want to fill your lungs completely. Hold for a count of 4, and then breathe out through your mouth for a count of 8, very, very slowly. And you keep repeating that until you calm down. I have yet to have this fail when I do this with a patient. Next, ground yourself. Use grounding techniques to connect with your present surroundings. Focus on sensory experiences, such as touching a textured object, identifying different sounds, or describing objects around you. You'd be surprised how much we don't pay attention to what's going on right in front of us most of the time. We're so easily distracted by so many noises and other things in the environment that we forget what's right in front of us. Challenge negative thoughts. Panic attacks are often accompanied by negative thoughts and catastrophic thinking. Challenge those thoughts by asking yourself if they're rational and based on evidence, not what could happen, what would happen, what might happen, what is happening. Try to replace those thoughts with more realistic and positive statements. I am having a panic attack. Panic attacks are not fatal. They will pass. The more that I can focus on deep breathing and being in the here and now, the quicker my panic attack will go away. Use visualization or imagery. Close your eyes and imagine a calming and safe place, maybe a beach, a peaceful garden. Visualization can help distract your mind from the panic and create a sense of relaxation. After all, panic attacks are happening in your thoughts that are triggering them. Yes, you have physical feelings, but they're triggered by your thoughts. So if you change your thoughts, you change the panic attack. Progressive muscle relaxation is another one. You can start from your toes, and you tense up your toes as hard as you can, and you hold that for a little bit, and then you slowly let go of the tension in your toes. And you work up your body, each and every muscle group, until you get to the top of your head. That'll help you release a lot of the physical tension that are associated with panic. Another idea is to practice mindfulness, paying attention to the present moment without judgment. Mindfulness can help you accept your feelings and thoughts without becoming overwhelmed by them. Use positive affirmations. Repeat positive and reassuring statements to yourself. For example, this will pass. I can handle this. I'm safe. These can be helpful. Other people benefit from seeking support. If possible, reach out to someone you trust, a friend, a family member, even a therapist. Talking to someone during a panic attack can offer comfort and understanding. Refrain from escape or avoidance. Resist the urge to escape or avoid situations that trigger panic attacks. Facing your fears gradually with the support of a therapist can be beneficial in the long run. That's one of the things that we do in my practice is exposure therapy. We expose you to the stimulus until you become less responsive to it and your panic starts to subside. Consider professional help. If you experience frequent or severe panic attacks, consider seeking help from a mental health professional. They can provide you with tools and strategies that are tailored to your specific needs, your particular panic. So remember that coping with panic attacks may be required practice. It may require practice and patience. Be kind to yourself and acknowledge your progress along the way. If you're unsure about how to handle panic attacks, consult a mental health professional. That can be invaluable in developing effective coping mechanisms. So this is information about panic attacks from stopmyocd.com. We do have a free OCD support group at stopmyocd.com. So if you or someone you know has OCD or a family member with OCD, it's a great place to come. It's free, happens several times a month, and we'd love to see you there.